size and state your name for record, and you may begin your testimony.
Thank you, Mr. Chairman. My name is Kristy Herera, and I am Director of the Health and Human Services Task Force at the American Legislative Exchange Council, or ALEC. We are a nationwide nonpartisan association of state lawmakers with 2,000 legislators across the country, 111 members in Congress, 5 members of the Senate Public Health Committee are also ALEC members, and we are led in the state of Arkansas with a great bipartisan delegation with Representative Linda Collins-Smith and Senator Michael Lamb. So thank you for the opportunity to share my thoughts on Senate Bill 709, which, as Senator Urban suggested, requires state agencies to report costs to the legislature, as well as any evidence of existing state-level statutory or constitutional authority before any provision of the Federal Patient Protection and Affordable Care Act is implemented. Senate Bill 709 is actually drafted based on an ALEC model bill that is now being debated by 7 state legislatures. I urge you to consider 3 key points about this bill: the power of the legislature, transparency, and budgetary best practices. First, we believe that Senate Bill 709 preserves and strengthens the power of you as state lawmakers to set policy. You know, like many states, Arkansas might find itself in a position where you lack the clear statutory authority to implement parts of the Federal Patient Protection and Affordable Care Act. What Senate Bill 709 does is that it vests that power within the General Assembly. So you as lawmakers can develop a clear statutory framework if you choose to move forward with implementation. You know, I'm sure many of us in this room would disagree on whether or not health reform at the federal level is a good idea. And I think that's another debate for another time. But what I think we can all agree on is the fact that any state action related to federal health reform must only be considered after careful consideration by our elected state lawmakers, and that's what Senate Bill 709 strengthens and protects. Second, transparency. There are going to be a lot of costs associated with federal health reform, some known and some unknown. The Heritage Foundation estimates that the Medicaid expansion alone will cost the state of Arkansas $330 million between 2014 and 2020. And that $330 million figure doesn't take into account costs related to the health insurance exchanges or the individual or employer mandates. So what Senate Bill 709 works to do is to reduce this budgetary uncertainty. Specifically, the bill requires the state agencies to report to the legislature any cost to the state, but also any cost to citizens. And I think that's an important distinction to make, because along with state governments, individuals and businesses in Arkansas will be affected by the federal health reform bill and will incur costs. And I think they have a right to know how the law will affect them financially. Third and finally, best practices when it relates to the budget. All bills in any state legislature are first studied for their financial impact. And so what Senate Bill 709 does is require a similar fiscal review for federal health reform. I believe that knowing the cost of federal health reform will help you as lawmakers to protect other state funding priorities. The National Association of State Budget Officers reports that prior to enacting federal health reform, 37 states cut funding for law enforcement, 21 states cut funding for transportation, 35 states cut funding for K-12 education. I think that it is our duty to ensure that any spending on federal health reform does not crowd out funding for these areas. In conclusion, we applaud Senate Bill 709. We think this legislation is a good government bill, no matter where you stand on the health reform issue. Thank you so much, and I'd be happy to take your questions.